COVID-19 is the disease we get when the coronavirus infects our bodies. How can this disease be spread? It can be spread from the microdroplets from one person to the other, or it can also be spread if we rub our eyes, we touch our mouth, and we also rub inside our nose with the fingers that has been touched on the infected areas. How can someone be aware that he might have a COVID-19? The symptoms, the person can either have a dry cough, fever, sore throat, body pain, loss of smell or loss of taste, tiredness, and difficulty in breathing. Everyone is at risk of having COVID-19, but we have those people who are mostly at risk, like our elderly people, the people who are having medical conditions such as hypertension or diabetic or heart conditions, and also people with obesity. How can this condition be managed? COVID-19 does not have a medication yet, even though there is a vaccine that we'll be getting from our government. But once the person has been tested for COVID-19, isolation is the most management for COVID-19 for up to 10 days. The preventive measures for COVID-19, even though the vaccine can help us from getting the vaccine, but there are measures that we also have to put in practice so that at least we cannot contact the condition. We have to wash our hands regularly, at least 15 seconds, with soap and water. We have to sanitize our hands with sanitizers. When we are coughing or sneezing, we have to practice the good technique whereby when you sneeze, you just have to sneeze into your arm, or either you can use a twitch whereby after you have just coughed or sneezed in the toilet paper, just make sure that you dispose it in a very good area. We must also avoid hugging, avoid kisses, and avoid shaking hands. And the other preventive measures that worldwide we are practicing is wearing our mask. Make sure that all the time you wear your mask.